your hands together for John. I'm now going to hand over to you, Peter. Over to you.
Good afternoon, everyone. This day has finally arrived, the official launch of the InReach model. There were times when I thought that we wouldn't get there, but we did, with the determination of a really committed team. And for those of you that don't know why we're here, if you look at the data around black health in North West London, you will see that there's huge disparity gaps. And one of the things that we're doing is co-creating the interventions with the African Caribbean Think Tank, which is a collection of community leaders in North West London. Some of them are sitting right in this audience today. It's such a proud moment, and we're moving from recognising the problem to making sure that we do something about it. 2025, it's time. I know we're at the end of 2025, but it's time now that we move to that space. And part of today is when you see people with the t-shirts saying, "Come, can I help?" please do go and have a conversation with them around what some of the solutions are, because we need to get into that space now. I'm so proud of the people that have made it happen. I can see my Ashe family up there smiling on proudly. Even dragged my youngest daughter. She's going to be all embarrassed, Melissa. Thank you for putting up with all of Mummy's shouting and ranting. You know I love you loads. And the rest of my team, Eva's here. Suavi's here somewhere. I think she's sorting the food out. And my dear manager, Nicola Kay, is here as well. So enjoy today. We've got some good conversation. I'm absolutely honoured that we've got an obstetrician and gynaecologist in the audience. We've also got our Director of Integrated Pathways here, David, so do have a chat with him. Thank you, everyone.
Thank you, Julie. Good afternoon, everyone. It's really a great day that we've managed to get the InReach launch. As someone who knows me, I'm very committed to working with the community. One of the things I always say is that we plan and we commission and we assume that everyone is going to do the things they're supposed to do, whether that's pitch up at a surgery or pitch up at a clinic, not realizing that people have lives, people have zeros, contracts, people have competing issues, people just don't have time. I think it's really important that we realize that if we want to improve outcomes for everyone, that we kind of meet people where they are. And that's the whole idea around the InReach model. So making sure that services are where people are. So I want to invite a colleague and a friend, someone I've worked really well with and has done a lot of work and is really embedded in this community. And she's going to share a few words on our vision, because it's something that we're working on called the African Caribbean Think Tank. And that's something which we hope will influence policy and health and change the direction of health for the African heritage community as we're going forward. So it gives me great pleasure to invite Christine Remington to come and say a few words to you.
I've got my props here. Got my props. So the first, yes, nice jacket. Like the jacket? Give it a swallow. Are you ready for salsa later? Okay, so all of this is wonderful, and so I'm proud to stand here and acknowledge we've come a long way, haven't we? We've come a really long way in terms of, as June often echoes, not admiring the problem. The data is irrefutable. There are health outcomes for the African and Caribbean heritage community which are so distant from the wider community that we have to act differently. Agreed? Wonderful. In the name African Caribbean Think Tank, can anyone tell me the acronym that it spells? What does it spell? ACT. So we're here to act. So I hope you spent the first hour going around the different stalls, talking to different people. I hope you've been on the bike and made your own juice. Have you been on the bike? Go into the library, go on the bike. It's all about us acting together. Now, for a long time, for 30 years, October, I celebrated 30 years working in the voluntary sector. What we've done was brought our power, our activity, our action together. We've pooled our efforts of people who have got the trusted relationships, clinician and cultural vendors all together. We have this blended approach with everybody working together. So some people wonder, what are you doing here? What are you doing? The mission we have is promoting the fact that health is in our hand. Whose hand? Our hand. And together we will close this big barrier. Agreed?
We have had leadership, we have had support from the top when it comes to the health agenda. And the person who I've been lucky enough to have been leading it since I've been here has been Councillor Mohammed Butt. So I'll just invite Councillor Butt just to say a few words.
I think, Christine, the point you were making about sort of our communities and the challenges and the health inequalities that we face, we do need to talk about them. We do need to make sure that as councils, as NHS partners and colleagues, I want to say thank you to all our NHS colleagues as well for being here as well, for being part of the conversation. And from trying to understand the communities that we serve is absolutely key and critical. Let's make sure programs like this, the InReach program, where we go out into the community, bring the communities with us, and we listen to the communities and provide that support to every single person, regardless of where they've come from, regardless of what they believe in. It's about equity, isn't it? Making sure that no one is left behind and giving them the same opportunities that all of us have had, and making sure that no one is left behind. Give them that ambition, give them that aspiration to do the best that they can, not just for themselves, for their families, but also for our communities.
But this is brilliant. There's going to be no more excuses saying the hard to reach communities, right? So this program now, everybody coming together, means that there's no excuse. And for too often, there's been excuses as to why the disparities in black health is so different to everybody else. And so having this kind of initiative is just incredible, because it means that now you're getting the resources and the experience and all of the experts going to where it matters. So I am super chuffed with this, and thank you to everybody that's here today. Let's make sure we spread the word, let people know that this is happening, and this is a resource that's here for everybody in Brent, because we are beautiful together as a united community. You know, we are each other's allies. So let's just keep that energy and vibe and community going. Thank you to everyone, and have a wonderful Christmas and a Happy New Year.
Sorry, the variety of things here that you can take part of, health checks, kidney checks, please do make sure you get them. As I said to you, we brought all these services here. In the forms that are here, we've actually feedback on things that you would like to see, and this is your opportunity, because then I can speak to my wonderful commissioning friends here and help me get these services here in the community where we can do them. So please do feedback. This is your chance to say what you have to say.
You know what a real honour it is to be here today at a launch of a community initiative that really puts the voice of the African Caribbean community at the heart. We're launching this today and giving the power back into your hands, allowing you to shape the real strategy that's going forward. So it's a real pleasure to be here with the Member of Parliament and the Leader of the Council to really reinforce our support for you today. Thank you.
We are not hard to reach. And so today is the launch of showing everybody that we are not hard to reach. You've also heard from Christine saying it's your health in your hands. You have to take responsibility as you have done today. So I think you lot should clap on yourself. That means give yourselves a clap. Give yourselves a clap. Well done.
Yes. Yeah? I was concerned. I was concerned. Huh? When you phoned me, I was concerned. Oh, you forgot? No, I never forgot. I'm not forgot. No, I never forgot.
Listen. Get a phone call.
Huh?
Get a phone call from the doctor.
Which doctor?
My doctor.
Not the witch doctor?
No, not the witch doctor. Come on. My GP.
Oh, your doctor.
Come here, man. Come here. What are you so far from? Listen. He said to me, Mr. Williamson. He said, Mr. Williamson.
Make yourself a home?
No, man. That's not it. There's no drink tomorrow.
No, I'm just saying.
Yeah, anyway, he said the PSA.
He says, hey,
PSA. PSA, Pacific Antigens.
PSA?
Antigen.
So why you never say that?
Up in the sky.
Ghana?
Oh.
Or you get to
Sorry,
back?
huh?
Or you get to back?
Well, listen, hold on. So, he said I gotta go to the clinic and
Antigen,
Prostate specific antigen. The prostate specific antigen.
The PSA.
The PSA.
Prostate specific
Antigen. You know what another thing I want to tell you? You see when it comes to the Afro-Caribbean community?
Afro?
The Afro. No. You're Afro girl, not it's short for African. The radiation one. You know the radiation, not the nation, the radiation.
The radiation?
No, not the radiation, the radiation theory. Not radiation. Radiation. It's a procedure. Anyway, before you take the radiation there, you have to go on hormone replacement. Hormone replacement. That means then take out your hormone, which is testosterone. The man one is testosterone, and the lady one is estrogen.
But I was in East London the other day.
Now estrogen. So then you go and take the tablet when you're doing that one there. So the virgin said to me, do you know Winston? He said, from me to the hormone theory, I'm a nearly at 36. You understand? 36. I said, Lord God, I don't want that one there. I do not want that one there. You understand?
You can't be going back.
Right? Definitely. So, anyway, so what I'm saying now, you see, as I said that, we are more susceptible to the prostate cancer. So yes, so from you get to an age of probably 20, from you get to an age of 35 to 40, as in the Afro-Caribbean you forget it checked.
So for my turn.
You're well past yours, Uriah. Uriah, you're 55. You're supposed to go check it already. No, it's all right. So please tell me, make sure you go check your prostate.
Never go.
Yeah? You promise? You promise? All right. We'll take care. We'll see you.
And sharing is what?
Sharing is caring.
Yes, sir.
All right. We'll take care. Remember what it's called? Remember what it's called? The prostate specific antigen test.
PSA.
The PSA. You got it. Well done.
Yeah. Hi, my name's Lorraine Chang Edwards, and I am the involvement manager for Brent at the Northwest London ICB. And today's event was absolutely amazing. It was really nice to see all the residents and community groups, organizations come out, and there was a lot of information shared, and we had a good time at the same time. So it was an amazing event, and I was so happy I could be a part of it. Thank you.
Today the really event went well. We just had some information about health protectionists, especially TB and vaccinationists. We really engaged a lot of number and some information, but thank you so much. It was a great day.
Hi, my name is Mary Detrimo, and I'm here on behalf of NHS Blood and Transplant for the Community in Reach event. We're able to raise awareness for blood donation as well as sickle cell, and it's been great to see how other people have engaged with this event. We've had the MP Dawn Butler come, we've had the Mayor of Brent come and share his insights, and obviously we are here specifically to raise awareness for blood donation, specifically in the Black and ethnic minority community. So it's been great to have a chance, dance, mingle, have some great, amazing food while trying to save lives. So just as a final thought, your one donation can save up to 3 lives, and we hope to see you at the next event.
So today's program at Brent Civic Center is one that aligns perfectly with the mission and vision of Ghana's Fresh, which is we need to have improved and increased awareness about what options we have when it comes to health and improving our health, in terms of raising our well-being and maintaining optimum health. So today's program and Ghana's Fresh are like twins, two peas in a pod. We align very well and go very well together, a bit like bread and butter.
My name is Moji Ejikutu. I'm a mental health nurse, mental health practitioner, and also a community clinician with the Burnt Out Matters program. I work at the Health Inequalities team for CNWL. I'm here today to be part of the program in bringing services to the community. We're working differently now. Most of what we're doing now is coming into the heart of the community to listen to their voice and using what they're saying to shape the services that we're offering. It's been so lovely today to hear people's voices and to give us feedback about areas of improvement, which we're going to take back to management, and we hope this collaboration and this continuing work carries on into the future.
So we're here at the event today, Wembley. Introduce you to my team. We got Graphic-ish over here. We came out, we representing people. Everyone was friendly today. It was a good vibe. There was music, as you can see, people about health consciousness and all that sort of stuff. You can see our jackets here. We're here promoting. We're here with Nines Health and Fitness Club also. So yeah, it's been a good day today.
Hi, I'm Bernice Apia from Black Health Legacy, and I am a research facilitator and community engagement lead. So essentially I work on a study that has been sponsored by the Wellcome Trust, and what we seek to do is understand diseases that heavily impact Black people. We have a particular focus on three main areas: type 2 diabetes, kidney disease, and hypertension. So we found out in our early findings that Black people are heavily underrepresented in genetics research. In the UK's largest biobank, which is just a depository of genetic data on people in the UK, we make up 1.6% of the people within a capacity of 500 people. So what we seek to do is to improve the future of Black health outcomes. This is not just a regular research study. This is about making sure that everything is rooted in local priorities, making sure that we look back and ensure that we correct the mistakes of the past and go into the future, ensuring that we ensure future better health outcomes. Thank you.
My name's Anne-Marie Morris. I am from Brent Carers Centre, a local charity supporting unpaid carers in the borough. I'm here today at the InReach Day at the Brent Civic Centre to obviously promote the support that we offer to unpaid family carers and raise awareness, and also to network with other organisations and professionals. Today's been a lovely day. It's been an engaging day for the African Caribbean community who are looking at addressing the health inequalities, and I'm for that, and I'm really pleased that I came today. It was wonderful, lots of entertainment, good food, lots of lovely conversations, lots of lovely information stores. What more could you ask for? And hopefully we are working together to improve the health inequalities for the African Caribbean community. Thank you.